This is a panel discussion about low carbohydrate diets in PIK3CA related overgrowth spectrum disorders, which is a wide variety of clinical presentations. And so, what we hope to do here was collect people with very different reasons to be using a low carbohydrate diet, different kinds of diets, so that people could just share their experience. So, none of us are here as experts in anything except for our own experience. My name is Christy Collins. I run the MCM network. I have a daughter with MCM, or also known as MCAP. She's 16, and we started a ketogenic diet about the time she started taking alpelisib. And the reason was because I had the privilege of having a meeting with Lewis Cantley, who is a cancer researcher who specializes in PIK3CA and discovered PIK3CA. And he strongly recommended it to me. And my first impression coming out of that meeting with him was like, oh, there's no way we could do, like, I wasn't even really considering it. But the way I am is that I just always want to read and learn all about everything. And I got home and I started learning more about it, and then also joining some groups for different kinds of keto diets for children. And I realized that I already was controlling everything my daughter eats because she has pretty severe developmental disabilities and her eating is very habitual. And when I sort of put those two things together, compared to the challenges that other people with children had, it actually probably wasn't going to be that difficult for me because I already had this kind of level of control over what my daughter ate. And so we started doing it based on Lewis Cantley's recommendation. So we didn't have a very specific clinical reason except to maximize the effect of the drug and minimize side effects based on his advice. And I thought that she would probably be on the drug very long term, and it would just be a good thing to establish. And so part of the problem with that for me has been that it has been hard for me to tease out the effects of the diet versus the effects of the drug because we started both at the same time. And so it's hard for me to say what its effectiveness has been for her, although I can say she's had no side effects from alpelisib whatsoever. And she's actually at 16 years old, she's on the adult dose. She's on the highest dose. But it hasn't been like, it's not like she's all better. She still has a lot of disease characteristics, and there's a lot to be desired in terms of the treatment for her. So that's its effectiveness. And then the last thing are the downsides. And I would say the downsides for us, when we first started, I think I had her on a little too strict of a diet. And the way I figured that out, she had become constipated. And we got a blood meter, which was a Keto Mojo, is a little medical device that you test blood for ketones. And I discovered that her ketones were actually very high. They were like in the 4 to 5 range. And there was because we weren't managing epilepsy, she doesn't have epilepsy. There was no need to have her ketones be that high. So I started to kind of pull back on the diet. And since that time, she eats a diet that is probably more flexible than what a strict ketogenic diet would be. And as time has gone on, we sort of cheat more and are flexible more, but the habits are kind of well established for the diet. So she continues to eat that way, but it has gotten easier over time, and we've gotten more flexible with it over time because we don't really see big negative effects of doing it that way. So I don't want to be the one talking for most of this. So now Mandy's going to run through and introduce herself and sort of go through all those things I just went through for Signe.
Yeah, I'm Mandy. I'm 51 now. I was diagnosed with PROS when I was in my 30s. I just have a general diagnosis of PROS, so no subtype like Cloves, FARV, or MCM. I started Apellicip, I think it was 2021, and as we know, one of the side effects is hyperglycemia. So at that particular time, the doctor put me on the tablet metformin. Now, me and metformin are not best of friends at all. And the gastro problems were just, as well as the gastro problems lumped with epilepsy, it was just a no-go. So after a little bit of research, came across the keto diet that kind of suggested it would help with the blood sugar to lower that. So me being me, if I see something that might work, I go full steam ahead, tunnel vision, let's research it all. And I remember going on a few different groups on Facebook where it said a strict keto diet, cut the carbs down to about 20 grams a day, which is extremely difficult to do. But I kind of did the best I could with that, and it actually did work very, very well. Our blood sugar came back down to normal, and that particular side effect was kind of resolved. But epilepsy being epilepsy, we didn't get along. So after about 18 months or so, I kind of had to stop taking that just simply because of the side effects, even though it was working, because how I'm affected is just mainly overgrowth from the waist down, and it is very, very extreme if anybody's ever seen me. Um, so it was kind of frustrating that I had to stop the epilepsy. But then I thought, well, I wonder if a keto diet would help or work just generally. So after a bit of Googling, Dr. Google, it kind of did say, that because with the mutation of the PIK3CA gene, it kind of does uptake a lot of glucose. And so metabolically, those kind of mutated cells are kind of affected quite greatly, really. So with the keto diet, it kind of says that it can kind of reduce that effectiveness or slow the growth down to some degree. Now, there is very, very limited research out there that talks about this. They have done some animal studies that does say that sometimes it can affect, in a positive way, someone with overgrowth of limbs due to PROS. So I thought, let's give it a go. There's nothing to lose. So I did try it. I'm still on it now and again. And it was very, very effective because I wasn't on any drugs at that particular time for PROS, so no sirolimus, no alpelisib. And I managed to kind of keep the overgrowth, not say at bay as such, but it slowed it down immensely and also to the extent it kind of helped a lot with pain. And I was saying to Christy earlier that I noticed that before I went on a keto diet, if I had things like high carbs, high sugar with a pizza, a chocolate, I noticed like a lot of inflammation in my body, and that would become quite painful. And I noticed when I was on the keto diet, that reduced dramatically. So it didn't only just control the actual overgrowth, it also controlled like the pain that went with it, and also my mood. If you're eating rubbish all the time, it affects your mood. So being on the keto diet really, really helped. Now, as I said, I'm very kind of tunnel visioned, and I thought, let's just go for it. So I kind of cut out as much as possible. So, not much sugar. So I didn't eat things like bread or potatoes or white rice and stuff like that. And also tried to limit the amount of, say, vegetables that are grown underground because they carry more carbs than the ones that are grown above the ground. So I kind of went very, very deep into it. But then I kind of noticed, as Christy said with her daughter, constipation was quite a major thing, and my body just didn't cope with that very well. So I kind of at times introduce now and again some complex carbs, whether that be brown rice, and I can't think of any other complex carbs at the moment, but things like that. And that kind of did help to get things moving. So that was one of the major side effects, but also kind of the side effects of like going out to eat. That is extremely difficult if you want to stick to keto, unless you're going to maybe a steakhouse, for instance. And I'm not a big meat eater, but I've had to kind of change the way I eat just simply because, meat is kind of a huge thing within the keto diet world. So I have found it difficult, and I'm not as strict with myself now. If I want a pizza, I will have it, but then I do notice how much something like that can affect my body and the pain levels and the inflammation that I can get. So, so yeah, you know, I know for me it works. It can make a huge difference to kind of my life, my mobility, my pain levels. It probably won't work for everybody with pros, as we know, in terms of even medication, it doesn't work for everybody with pros. So it's very much a balancing act as to whether it works for you or it doesn't. But I know, like Christy was saying, she was advised medically about it. I'm not. I just took it upon myself to give it a go, and you learn along the way. And being an adult, I can make my own choices as to whether I stick to it, I don't stick to it, and yeah, I think that's about it, really. I don't want to go on too long.
I just want to correct, I actually wasn't advised medically. And
You weren't?
that,
Oh,
no,
right.
I know it sounded like that, but I want to
Hmm.
clarify.
Okay.
Lewis Cantley is a scientist, and I was meeting with him like on an at an advocacy level. He wasn't really he's not really someone who can give you medical advice. He's not a doctor. Yeah, so I just wanted to be clear about that. And this has actually been part of my own hesitation about broaching this in the community further, is that I think it can be tricky to do this without medical management or at least cooperation. And I know it made Signy's doctors a little nervous.
Yeah.
So, okay. So, Julia, are you ready?
I am ready.
Great.
Thank you so much for having me. So I am the mother of Marlo. He is 9 years old. He's a very complex child. He has MCM and had a stroke in utero. So he has also polymicrogyria. And as a result, he has epilepsy. And his overgrowth is primarily contained in his head and brain, but we had noticed that he had a leg length difference. So we are on alpelisib in addition to 6 anti-seizure drugs. So he is heavily medicated. But when he was 18 months old, actually, he might have been younger than 18 months, we were doing a week-long EEG study at Children's in Denver. And the keto team came to him and said, this is something because of his epilepsy that you absolutely need to be considering. As I'm like shoving a spoonful of mashed potatoes in his mouth, they're like, don't do that. But so about a month later, we became fully ketogenic. He is on an a modified Atkins diet, which, as I've always been really interested in nutrition, even before I had him, and I was very concerned at, on at the onset of this because I didn't want him to miss out on phytochemicals and to be getting different colors in his diet. And so we decided instead of going full keto that we would do the modified Atkins because then I have the opportunity to introduce fruits and vegetables and different kinds of proteins. And he has to have lots of fat, but it can be a really nice mix of fats. So the way that his diet is set up is that he can have 12 grams of carbohydrates per day. So he has 4 grams of carbs at each of his 3 meals. And we've just become scientists about it. But also one of the things that I regret is that we've kind of fallen into patterns of what we feed him because we are busy adults and it's very difficult to create new recipes for us. So we have the things that we know work really well and that he loves to eat. And so those become go-tos. He eats lots of avocado and raspberries and salmon. And he eats a diet that's like, it's gorgeous, right? It's full of beautiful colors and he does really, really well with it. And he likes the food. So I think that a lot like what Christy said. So I should say we are followed very meticulously by the keto team at Children's. He has to have blood work drawn every 3 months and they go through, we either have a call or a visit to go through all of the findings. And so we're constantly giving him too much fat, giving him not enough fat. We've had to like constantly change the diet, which is probably good for us. And it's really good that he is being so meticulously followed. And we've been able to uncover in those refinements a lot of things that are causing him discomfort so that we'll be able to navigate those together as a team. So we have a team behind us, which is really helpful. He had at one point, because we were feeding him, I was feeding him like pate and liverwurst to begin with, because I was trying to give him a lot of high fat, and his cholesterol got really high, which is unusual for people, as far as our team says. It's unusual for kids with a ketogenic diet that they would have levels as high as him, but his overall cholesterol was above 400, which is like horrifying. But we were able to get that under control by cutting the liverwurst. And because he's on so many medications, we don't know the effectiveness of the diet. It's really hard to say. I don't know the effectiveness of anything that we're doing, honestly. I can't say that there's one thing that is or is not working. And so it's all guesswork. He's on tons of medication. He's on alpelisib, although his leg length difference completely normalized, and now he no longer has a leg length difference. So like, I feel like it was 2 centimeters and now it's 1 millimeter of difference. So something worked there, but we can't say exactly what it was. His seizures are somewhat under control, but not entirely under control. But I do feel like he flourishes with the diet because he's a little bit more clear and he's extremely developmentally delayed in general. So he can't really tell us how he feels, but I do feel like his blood sugar is under control. And then we have data to support that. So I think that is my presentation.
That's great. I am so appreciative that you are here to sort of represent that highly managed perspective of epilepsy. A big part of how I learned about keto was by joining a Facebook group for epilepsy, which I feel a little like I shouldn't really be in this group, but I did tell them that my daughter was at risk for epilepsy. But
Yeah.
following those families and hearing how strict the diet can be for them, I think is a really important part of the big picture here in terms of the scope of pros and what all is involved.
Well, and I'll say too, Christy, that I see you as one of our advisors and guides. So I think it's totally appropriate for you to be in that group because
Oh,
I look to you all the time for advice. So
well, I actually found a patient in that group who was completely undiagnosed. It was Kaylee.
wow.
Yeah, yeah. So yeah. But I don't talk in that group because
Hmm.
I just try to listen because it's not my battle, I guess. I just wanted to articulate that it's different and it's pretty hard. And
Hmm.
but another thing that you said that I just want to touch on is that sort of reminds me of my experience is in the beginning, it's very difficult. And then, or at least for us, you can tell me if that wasn't the case for
Hmm.
you,
Hmm.
because it takes some time to figure out what foods work. And in that period of time, when you're figuring that out, man, we had so much food on the floor and just like, just chucked, that was refused. And then when you find the foods that work, I don't, I remember in the epilepsy groups, people saying, as long as your kid is eating, like it does not matter if they're eating the same thing every meal, every day, you just need
Mm-hmm.
them to be eating. And so that was sort of like, but once you sort of get over that hurdle where you've then established things that work, enough things that work that you can live your life,
Right.
um, it feels like you got over that hurdle, and then it's not as tempting to quit the diet because it's like, oh, you got over the hurdle. Why would you quit now? But it is, I'll tell you, when I saw Mandy gave a presentation at a meeting her organization hosted where she discussed doing keto, and I was so excited to hear about her experience because I every once in a while sort of waver and go, oh, maybe we shouldn't be doing this. Maybe I'm not sure if it's helping. It's so much work. And then because my daughter also cannot tell me how she's feeling or how she's experiencing it, it's so valuable to me to be able to hear someone who can say what the experience is like for them.
Mm.
And so it was so exciting to me to see that presentation and to hear that it was really helping Mandy and that she could feel it. Like she could really, like, there was no doubt about it. It's like, okay, we'll keep doing this. So I just want to sort of invoke a few people who couldn't be here because they have a variety of presentations and experiences that I think are valuable and interesting, and I just want to mention them. So one of them is Sarah, and Sarah's son Oliver was within, I think, the past year put on, I think it's low glycemic index diet to manage hypoglycemia, which I know is going to sound weird to some of the non-MCM MCAP families, but hypoglycemia or low blood sugar is something that our patients often struggle with, especially young patients. And we had a meeting in Manchester, an expert meeting, like many years ago now, where I met a neurologist who said that she was putting patients with this problem on a ketogenic diet and that it was helpful. But when I have mentioned that to endocrinologists or other patients who are seeing endocrinology for hypoglycemia, that sounds crazy to them to treat hypoglycemia with a low carbohydrate diet. So I thought it was very interesting that we now had someone in the community who was being treated that way. So I wish Sarah was here, but I just wanted to sort of put it out there that there is a patient being treated this way for that particular problem. And then the other person who was supposed to be on our panel, Hannah's son, Caden, was on, I really hope I'm representing this accurately, was on, I don't know if it was keto or some milder version of keto, like maybe Atkins, modified Atkins, but he actually graduated from the diet. His epilepsy, he stopped having seizures, and at a certain amount of time, they went off the diet. And as far as I know, he's still clear. So I just wanted to present that story as well. And then there are two other people that I just want to mention. And I'm mentioning all of these people I've spoken to, and they wanted to participate. So I'm pretty confident that it would be okay with them to mention their experience. One is Alicia, and she has Cora, who I believe is a very young adult now. And Cora was the first person that I was aware of who was using a ketogenic diet for epilepsy in the MCAP community. And Cora had had a hemispherectomy first, and then the ketogenic diet was the thing that actually worked for her. She had some side effects, though, that were difficult. She was not growing. And this was before alpelisib. I know we're all worried about not growing because of alpelisib now, but they attributed this to the ketogenic diet. She was not growing and she was having like bone density issues. And eventually, Alicia found that using Charlotte's Web or some variety of cannabis actually was very effective for Cora. And so they were able to stop doing keto and switch to that. And I probably can't accurately describe any more than that. But I wanted to mention her because they were sort of the first people I heard of that this was effective for. And then one more person. I wish they were actually here and I didn't have to just talk about them. But I just went to the KT support group meeting for Klippel-Trenaunay syndrome, which is another PIK3CA condition. And there's a patient in that community who lives in the Albany area where I live. And we ended up traveling home together. And we got to talk a lot about his experience. His name is Michael. I'll just say his first name because I'm not sure if it would be okay with him to say his last name. And Michael's involvement is actually not even typical KT involvement. I think it's mostly lymphatic and it affects his arm and his back. And so he does not have like widespread, systemic involvement the way like my daughter does. It's very specific to lymphatic. There may be some vascular, but I'm not sure. He wears compression on his arm. And Michael's been on alpelisib for about the same amount of time as Signe, so it's a long time. He's not on the full adult dose. I don't remember exactly what dose he's on, but he describes very reactive experience with alpelisib where he really feels it working. And, if he misses it, actually, he says he never misses a dose. What Michael says that is really interesting to me is that if he eats a lot of carbs, so I don't think he would describe himself as being on a particular diet, but he is conscious of what he eats. And he says if he eats a lot of carbs, that he can really very immediately feel the effects. And this is sort of like what Mandy is saying as well. And so to the point where we were getting breakfast in the airport at some ungodly hour, and it was like, okay, get the bagel, which is like affordable, or go sit in the restaurant and get an omelet, which costs 3 times as much money. And he says it's almost like the medicine does nothing if he were to eat the bagel for breakfast. It's like he's not even taking the medicine, and he gets an immediate sense of the effects of those things. So I just wanted to bring him up because for those of us whose kids can't tell us how they're feeling, this is just amazing information. And I think it's not just that Michael can talk, but also the type of involvement that he has is probably also very reactive and different. So I don't want to say that this would be the case for everyone. It may be also specific to his involvement. But I just wanted to mention that to sort of describe the diversity of experiences that we're aware of. Okay, I didn't want to talk so much. But I think at this point, maybe we could go through and talk about. So none of Marlo eats regular food. Did he ever have a feeding tube? Was that ever part of your experience?
He does not have a feeding tube, but he has to eat soft solids. So he can't chew,
Uh-huh.
but he can mash with his tongue. So that's why we do a lot of the soft foods, and we have to do special things with his chicken and whatever we're feeding him to make it so that he can swallow.
Gotcha. I thought the liverwurst was really interesting. We're vegetarians, and I know, when we started, I thought, oh, I guess we're not going to be vegetarians anymore. And then when we would go to like a family function or something, I would try to give her some of the meat that they were serving, and she won't eat it. She doesn't like
Mm.
it. So she has continued to be a vegetarian on the ketogenic diet. But like we are not doing the same kind of like we are not restricted to 12 grams of carbs a day.
Mhm.
We are just winging it. Like I don't track that kind of stuff. What I do is check her ketones periodically and make sure she's in ketosis, and that is sort of my measure.
We've dropped off on checking ketones. I had actually forgotten that that was a thing that I needed to do. But, we were very diligent with it for like the first 4 years. And I think we've just gotten into this rhythm and sense of like how he's feeling based on the diet. And because we have so much blood work that we know he's in a proper level of ketosis. But he does have to be pretty high in terms of ketosis. But our family keeps this like smoked salmon business afloat because we we eat so much smoked salmon with Marlo. So
No,
it's
I think of is salmon. I think of salmon as lean. Is there fat in salmon, or do you have to then add the fat?
I pour olive oil
Yeah.
basically on everything.
Okay.
So yeah.
So I'm just going to mention, and I don't know if did you ever do a ratio diet, or was it always Atkins?
We've always done Atkins, but there is sort of with the diet, they want us to have a certain proportion, like he has to eat meat at every meal, and then they want us to add a certain amount of fat to each meal, but it's not like the 4-to-1 ratio.
Yeah, so I'll just state this for anybody
Mhm.
trying to learn about this, that if you start a ketogenic diet for epilepsy, especially younger kids, they're often put on a ratio diet where they get a certain percentage of their calories from fat versus protein versus carbohydrates. And those diets are like, you really have to be like, I think the parents will have an app and then they have a nutritionist that works on them to develop recipes that fit their ratio. But it's very demanding and it's a little bit of a different experience, I think. It's just certainly different from what I'm doing, which is just like loosey-goosey, probably nonsense to those people. This is part of the reason I don't speak in the epilepsy group, because I think I would just be so annoying to those people who are having to follow this extremely strict, rigorous. So I just wanted to mention that. I think there is the research for keto for epilepsy in general has been moving towards the idea that the less restrictive diets can still be very effective. So I think it used to be that people were always put on these very restrictive diets, and you hear more of a variety of experiences now, I think, in that community, particularly if people are starting them at an older age. So I wanted to say the liverwurst is interesting because it's like, or pate, because it doesn't have that meat texture, and I could see how you could get over the discomfort with the texture of meat with that. And I might try that. Although I'll have to watch her cholesterol. But I wonder if anybody else has like food hacks maybe that helped get you started, or I know for us, I would say like when I first started, I was trying to recreate all of her favorite foods, but keto, and it was such a disaster. Like because it just doesn't work. Like you can find a recipe for a keto pretzel, but it's not the same. It's not as good as as some real food that's like just naturally keto, keto proportions and keto appropriate. And so, occasionally we've been able to find some baked goods that work, but a lot of them were disastrous and a waste of time and money. And so I know, Mandy, was there anything that helped you, kind of like particular things that you ate that helped you sort of get going? Did it take a while for you to find different foods that worked? And
I think, like Julia was saying, that you end up kind of eating the same things all the time because you know that it works. Things like salmon, and cauliflower rice, which tastes of absolutely nothing, but it's the only alternative. Or because there are some like keto accompaniments out there, like alternative spaghetti type things or rice type things, but they seem to put stuff in them that how shall I say, a bit like a laxative effect. So you've got to be careful of how much you eat of those types of things because, you're never going to eat them again otherwise. And as you were saying with the baked good, things like trying keto bread or making keto bread. Oh, no, absolutely not. I'd rather not have it than have that. It's just the consistency, the lack of flavor. It's it's no point having it, in my opinion. I just don't like, if you're trying to make things like little cookies, peanut cookies or something, and they dry, they stick to the top of your mouth. So, it's just like, it's not a treat. You go to all the effort of trying to make these things, and I've just found it's better off sticking to things like, like fish and meat and yeah, cauliflower rice, and vegetables. And that's really, if I'm fully keto, that's kind of my staple diet, really. I do try and sometimes concoct things. I'm not the best cook, but I'll just chuck some stuff together and see what it tastes like. If it's good, great. If it's not, I won't be having it again. So it's trial and error, really, but like I said, I know how beneficial it is for me to stick to it, but it's hard, very, very hard. And at the moment, there's too much going on in life to kind of think about, sticking to the keto. It's just like grab whatever is going at that time. So it takes a lot of discipline and determination to kind of keep it going. I think that's what I struggle with at times.
I often think the amount of effort I put into cooking for Signy, like I cannot imagine putting that effort into preparing food for myself. Like if I was the patient, I would not make myself 3 batches of treats a week and like that are keto and I would absolutely not. I'd just like probably be snacking on nuts and olives all the time. So, yeah, it's time consuming. Julia, when you were talking about the testing that they do for Marlowe, one of the things that you see a lot of in the epilepsy groups are for keto is acidosis or deficiencies of. So I just want, you mentioned his cholesterol. Has he had any other complications like that? So one of the things I worry about is patients doing like what we're doing and winging it and then not having those things monitored. And because we're doing alpelisib, we do get some kind of basic blood work regularly, and it does catch CO2 that if she became acidotic. It turned out Signy was acidotic at baseline, just mildly so. And so when we started, it sort of looked like it might be from the keto, but then I looked at her old labs and she had always been mildly acidotic. But I just wanted to sort of I wonder, have you had any experience with that? I wanted to raise it in this forum so that it's just mentioned.
Yes. So he actually hasn't ever been acidotic, but he's been very high keto. And so that's why we have to add olive oil to everything. So the higher you keep the fat for him, the higher we keep the fat, the safer he is in that range. We also sometimes, with communication between husband and wife and caretaker, sometimes we accidentally miss some carbs. So if he doesn't get his block of cream cheese at lunch, then sometimes he has trouble if his carb intake is too low and we haven't communicated well. So we try to, that's another reason to keep the meals the same so that everybody knows what part of it they're responsible for. But he has had I'm having a hard time remembering what the nutrient was that he was short on, but we just will be able to add nutrients that he needs. And then he has like a vitamin powder that we have to add to every meal in addition. And then he's been taking iron lately because his iron levels, even though he's eating a lot of meat, his iron levels were really low. But it really is, I think, important. The biggest thing that we realized was that he was not getting enough liquid. And so he has to drink a lot. He drinks way more water every day than I am supposed to, and I never do. And so because his drinking skills are limited, that's the thing that we have the hardest time getting him to do, is to keep drinking his juice, what we call his juice, all day long. And so he actually was starting to get crystals in his urine, and that was partly because of the ketosis that he's in. But we just make him drink tons and tons and tons and tons of liquid.
Yeah, so that's
So,
a risk for kidney stones. Is that what?
mhm, right.
Yeah. So Signy drinks a ton of water, but she always has, and so that hasn't been a big worry for us, but I can totally
Mm-hmm.
imagine how that would be difficult. You often hear this is where the feeding tube can be really useful, especially if somebody
Mm-hmm.
doesn't drink well. Well, we can end. I don't have to keep us here. I think this was great. I think this was very sort of comprehensive and represented a lot of different kinds of experiences. And I really appreciate you guys doing this with me. I had the idea for this for a very long time and I've been very excited about it. So thank you.
I just kind of just was wondering really if for anybody, whether it be an adult with PROS or a parent of a child with PROS, before we kind of like start going down the road of any kind of changes in dietary plans, is it always best to kind of speak to your, if you have, luckily have a specialist, just to let them know this is what you're thinking of doing. I mean, I did and didn't. Obviously, I did because I had hyperglycemia, but then I've obviously continued with the keto diet since not being on the epilepsy. But, for it doesn't work for everybody, I won't assume. So is it always best really to kind of seek medical advice before you jump into something like that? 'Cause, talk about missing out on certain nutrients or vitamins and, you know, that could potentially be dangerous for some of us. I mean, who knows? Like everybody's body reacts in different ways, doesn't it? So,
Yeah, that has been my concern about bringing this topic up at all.
mm.
And I do think that if people are doing the diet more casually versus how Marlo is doing it, or even patients who are doing a more severe diet, even than, or a strict diet than Marlo is on, the risk of those kinds of side effects changes. I think the problem, I mean, I think it would be great if everybody could go to their doctor and ultimately, anyone who tries a diet like this is going to end up in a medical situation where they need to disclose their diet. Like it's going to come up, whether you go to your doctor first or not. The problem, in my experience, has been that doctors are not dietitians. And if they don't have a dietitian to refer you to, they're not going to feel like they can support you in any way. And that is what I see happening in the vax, or at least that's how I'm interpreting, because they're sort of aware of this dynamic, but I have not seen it embraced in terms of directly advising people on diet. And it really just becomes more like if you become hyperglycemic on alpelisib, then try to lower your carbs. And I mean, the medical way to do this would be that you really need a nutritionist. It's possible that a doctor could order labs, but I'm not sure that most doctors are going to even know what to order. I don't, Julia, do you have any thoughts on this since you're actually having the medical experience?
Yeah, I actually just opened his. I mean, they run about 40 tests every time he takes. So I'm like looking through his, and it's phosphorus that he has had trouble. His phosphorus has been low.
So there can be electrolyte imbalances. I think that that's what that
Right.
speaks to. And I do know the patient I told you that I met in the keto group, she stopped eating keto for one of those electrolyte imbalances.
Hmm.
So it didn't work. She had to quit.
Yeah. So I think I would advocate for getting followed somehow and being able to have somebody, because there's so many tests that they have to do to make sure that Marlowe is safe and that we're not causing other problems. And that's really been what he's already so complex that we have to be
Mhm.
really careful not to. to take him off in another direction unknowingly. So
I wonder if part of the complexity for him in terms of the testing is that he's also on all of those anti-seizure medicines.
yes,
It's
absolutely. Yeah.
possible that some of that testing, I mean, because Signy gets testing for alpelisib, and
Hmm.
it's not testing specific for keto, which
Right.
would have some overlap, but it's not
Right.
exactly the same. So, yeah, I mean, probably people who are already having some kind of testing because they're on medicines.
And the complexity of his epilepsy. So in general, I think that they're just trying to see what else could be causing the epilepsy. So I
I
totally
mean,
think,
it's ideal, but I would hate for someone to feel like they couldn't even approach this issue without their doctor's cooperation, because I think part of what I wanted to show here,
yeah.
I mean, Michael, who I mentioned before, I don't, he wouldn't say he eats keto, but he makes a conscious effort to manage his carb intake. And he has a direct experience of the benefit of that. And so I think that there are some kind of, there might be some like low-lying fruit, or I don't know what the expression is. Like one of the things I would advise people is that would be a really easy change to make. Well, easy sounds easy. It might not be easy depending on the individual, is sugary drinks. Like anything you're drinking that has sugar in it has a really dramatic effect on your blood sugar, like more so than if you ate like something that included fiber. Oh, and that just reminds me, another thing Michael told me is that he now takes a fiber supplement and he thinks that that has an effect on his blood sugar for the day. And from what I understand in terms of like eating like whole fruit versus fruit juice, because the whole fruit contains the fiber, there is some other evidence for the benefit of fiber in mitigating the absorption of blood sugar. I don't want to get too much into stuff that I'm not like actually an expert in. So I wanted to just sort of invoke that as his experience versus like some kind of scientific fact. But I do think the point I was trying to make is I think that there might be ways to modify carbohydrate intake that isn't as dramatic as a ketogenic diet that might be beneficial for patients without putting them in some kind of medical jeopardy. But it is also good to be aware that if you're the kind of person that goes whole hog into things, that you could create a problem for yourself if you're not being managed medically. I hope that is the right balance of managing risk here. I'll just say I am very available to discuss this. This is one of those things I could probably talk to people about much more than they actually want to talk about. And I know Mandy is available to people. And also, if there is further interest in this topic, we might do other things related to it. But
Maybe cooking classes.
well, I actually I have a domain name, PI3 keto.
Ah,
And I have had my background is web development, and so I have thought about putting something there because I do think like the needs of this community in terms of this issue are a little different from people trying to lose weight or people managing epilepsy per se. I mean, some of our patients are managing epilepsy, but more broadly, it's a broader issue than that. But the problem has been, so Lewis Cantley was spoke at ISPA a few years ago and has been talking about this for many years now, and I haven't really seen any uptake in the medical community. And so it's been hard to, and then also we've seen this real proliferation of misinformation right now in terms of medical things. And so it's a difficult balance to strike, I think. But yeah, I think there's a lot of things that could be done to sort of enhance understanding and about this. All right. Well, thank you, everyone. Thanks for coming, and thanks to the panelists. I really appreciate you guys. All right, take care, everyone.
Thank
Thank
you.
you. Bye.
Bye.